welcome back to another episode of Ask 360, where we are answering all your health and fitness rehab related questions. We're doing this one off the cuff in a physiotherapy in-service, so we've got a few members of the team here. But we've got a question here that comes from Karen. And Karen asks, I'm looking at getting some physiotherapy for a condition, and I'm wondering if I should get a scan first. Right. And this is something that we encounter in the clinic quite frequently when a patient or client will come to us already with their scans in hand. And for some people, it may make sense to have a scan and therefore what they perceive as a working diagnosis, which will then sort of guide the treatment in the right direction prior to coming and seeing a physiotherapist. And in some cases, that might be a valid approach. But there's certainly some cases where we wouldn't recommend that. And then, there's cases where that can actually be quite a hindrance to the overall sort of rehab process. So does anyone sort of want to go first in terms of, what they think might be an appropriate case for someone to have imaging before they begin the rehab process? Or alternatively, cases where they shouldn't?
Well, I think that depending on the case, as you say, going to see a medical practitioner is in advance is always good. Partly because we'll get a second opinion that isn't the client's opinion or patient's opinion, or we'll also get to hear from the medical practitioner's opinion. And if they think they need a scan, then that could be a legitimate reason to have a scan. And then it's always good, I feel, just to have that extra information. Of course, it's always important to how to present this. But, so in certain cases, if you suspect a fracture, then of course, imaging is needed.
Yeah, 100%. I think if there is a suspicion of a fracture, then a certain imaging protocol is recommended. And sometimes fractures might not show up on an X-ray, and maybe even on an MRI, we might see a bit of a bone bruising that we've actually been discussing this morning, but maybe not a fracture line. So you may need to take it to a CT and see and analyze for a fracture there. So I think fracture either is stress fractured, so someone's been got an overuse injury from running, and we suspect that there might be bony involvement, or if they have an acute injury where we believe there's bony involvement, then 100%. That's one area where we do want to do an imaging before we start any sort of management plan.
I think for me as well, I think two things come to mind in terms of appropriate imaging is whether one you fit in significant trauma or like a big sort of injury or accident. And yet when I guess fracture is suspected. Or second one would be if you're getting neurological symptoms with back pain, or sort of, what we call yellow flags. I think that's also appropriate to get a scan for your back before coming to see us so that we can sort of have an idea of how best to go about your treatment. But otherwise, if you're having just the average shoulder pain or knee niggle, then I think it's totally fine to come and see a physio without imaging.
Yeah. And I think there's no harm to come to the physio first as well, because if you're going to see a high quality physio, they will know whether you need a scan or not. And the thing is, the scans are a static picture of, a moment in time. They don't give us any information about sensitivity of the system, of how the system is working together as you move. And so it can almost, because these positive findings are, little injuries, let's say on MRI, like shoulder cartilage tear or, knee arthritis or a disc protrusion in the back, are so common in people that don't have and don't actually cause any symptoms in these people, because they're just a symptom of living, they occur due to living. I think sometimes it can cloud the judgment, and I've seen quite a few patients go down the wrong track and treat what they see on the image as opposed to what's actually the problem, because they haven't been assessed as a moving, functioning human being. They've just been assessed with a snapshot in time. And there is some research evidence to say that for back pain, at least, that pain actually lasts longer in people that do have an MRI, because it puts them in this fearful position whereby, they're stressing out. Stress, we know, can increase pain. Maybe the muscles are tightening up around the structure in a subconscious manner, because you've got this idea of something really wrong in there, when actually it may not, and may be a small part of the problem or not part of the problem at all. So I think first step, seeing like a high quality physio, you can avoid a lot of this stress and maybe go down the wrong path. And then they'll send you off if you need one.
Yeah, I think it's very understandable that patients will want to have that information, because intuitively it sort of makes sense that if there's something wrong, because pain is something that inherently we don't think we're supposed to experience, so therefore there must be something wrong with our body. And surely the most accurate way to see what's wrong with our body is to have this very fancy imaging that basically takes a photo of what's going on. But like you said, there is so much involved with pain that it may be a small part or not part of the problem at all. Pain is essentially an experience, and that experience can be modulated by a number of different things. And the perception of what's going on in our body is one of those things that can modulate our pain. So just having a higher degree of concern and worry about what's going on, which can be created when we see imaging findings of things that both look like they're not meant to be there, and are reported as such by other medical practitioners. That can raise the fear and therefore raise the amount of protection that we're getting, which is essentially what the pain experience is. So, I think that especially for back pain, it's prudent that we use imaging in context. And when it's prescribed, it should be prescribed by a medical practitioner that sets expectations about what they're looking for and what they're not looking for. And so one of the advantages of imaging is to ruling out or at least decreasing the likelihood of non-musculoskeletal conditions. So unfortunately, very rarely, in most cases, it's you may find people with back pain or shoulder pain that may have a very sinister pathology, such as a tumor. One area where we do want imaging is in a frozen shoulder. So in frozen shoulder, we always send people for an X-ray, not an MRI, but an X-ray, to rule out a tumor of the top of the arm, which can present very similarly to a frozen shoulder. And likewise, we can have lower back conditions that are cancerous in nature and or caused by other more sinister pathologies. These usually do have a pattern, and they don't usually fit the normal sort of mechanical pattern of a typical back pain issue. They may have a lot more night pain. They may be associated with other health issues like weight loss or general malaise and things like that. So, like Maureen alluded to, if you see a good physiotherapist, they should be able to identify some of those red flags and yellow flags as they come up, and that will add weight to whether or not we sort of refer for imaging. Alan also pointed out some neurological symptoms. Things like disc pathology, disc herniations, and disc bulges are very common in people without pain. Basically, if you take your age and add 10 years, that's the proportion of people your age who don't have pain, so asymptomatic individuals that will have some sort of disc pathology. So if you take me, for example, I'm 24. If you add 10 years to my age, thereabouts, 34% of people my age who've never had back pain will have some sort of disc pathology on the scan. And the same with other parts of the body, sort of knee meniscus tears, shoulder, rotator cuff tears, labral tears. If you're a good baseball thrower and if you've been throwing since you're a kid, you're probably 97% chance that you've got a labral pathology, because you basically can't throw a ball really, really hard without having some degree of instability in your shoulder. So if they were to go, and this is, we have people with, again, throwers without pain. So if you were to go through and mend every labral tear you saw on a baseball player, you'd basically have you wouldn't have a sport of baseball. So again, everything needs to be taken into context. So if someone has a disc bulge on a scan or a disc herniation, you've got to see how that fits with their presentation. If they have numbness and weakness in the legs, that is worsening over time. then yes, that's definitely a cause for imaging and most likely a cause for a surgical referral. If someone has pain in both legs or numbness and weakness in both legs, then that's a very urgent referral for MRI. That would maybe indicate what we call a quarter equina syndrome, which can have very serious long-term consequences. And so that's where the magic of imaging can really come into play. We can literally save lives and with the imaging techniques, but as we've alluded to, we can also make things a lot worse. Has anyone got any other thoughts on this?
I think this more or less came down to, should the patient see like a medical practitioner or a physio first? I mean, that's kind of where it came down to, because before they have imaging, they'll see the medical practitioner and refer them. So more or less for them, it will be, who is the person to refer them to imaging? Because if they come see us and we think they need it, we'll refer them. If we don't think, then we don't refer them. If they go to a medical or a doctor, if they don't think they need it, they won't refer them. But they might refer them to physio. Yeah. It's probably, if you suspect you have any musculoskeletal injuries or pains or issues, then you should see a physio first.
Yeah. I would like to think that every health practitioner, every medical practitioner sort of follows the same, a lot of guidelines in terms of referral processes for imaging, but unfortunately that's not the case. So we've just got to make sure that, if you do have an injury, and we can sort of, categorize them. If it's a traumatic injury, I think that the doctor should be referring for imaging. If it's an overuse injury that fits a typical pattern, if you go running and it hurts and settles down in a couple of days, then it's probably not cancer. It might be, but it's probably not going to be. And if and so that sort of presentation would be more appropriate for physiotherapy investigation to analyze all the different things, the biomechanics, the load management, psychological stress, sleep, nutrition, all those sort of things that may be contributing to the pain, and before looking at any sort of imaging. If you have previous history of cancer or strong family history, and there's other signs associated that don't quite fit a mechanical sort of pattern, then that's the times that we want to use imaging to our advantage. Also, other things like when we're looking outside the realm of pain, if you have a knee that is very unstable, it keeps giving way on you, or if you have a knee, in particular knee, that sort of locks and clicks in a big way. Now, clicking and cracking and all those sort of sounds are quite normal and don't necessarily indicate something being wrong with that body part. But if you've got very large sort of clunking type movements, then that may even, and sometimes these can be pain-free, that may indicate, something like a big meniscus tear that may not do well with non-operative management, and that probably needs to be screened with scans as well. And of course, instability in the knee may be indicative of a ligamentous injury, particularly if it's after an acute injury, and those cases should be scanned also. Any other sort of closing thoughts?
I mean, I think it's worth to mention as well that imaging is not just the only thing that we send people off to. Sometimes if we suspect maybe a systemic illness, like a whole body illness or like a rheumatoid condition, we'll send people off for bloods. And I think, there's a very knee-jerk reaction to getting imaging, but people don't tend to go sort of, I'm going to get bloods because like my hand hurts,
Yeah.
And so I think it's maybe just something to put the imaging into context, that it is a further investigation to pad out the diagnosis where needed. But it's just, it's a bit more common than say going for bloods, but I think it needs to be maybe considered a little bit more similarly.
Yeah, for sure. All right. Well, Karen, I hope that answers your question. Of course, if you are suffering some pain of any type or any sort of a performance issue, come and see us, and we're more than happy to take a look. And if imaging is needed, we will, or someone, as Maureen pointed out, any other investigations are required, we'll happily point you in the right direction. If anyone else has any questions, please send them through. We love talking about this stuff. We love answering questions, and we love trying to help you people out. So yes, thanks again for your question, and we'll look forward to speaking to everyone on the next episode of Ask 360. Have a great day.